Hi, so my name is Sophia Whitman, and my topic for this pathology project is bacterial meningitis. So, bacterial meningitis is the most severe type of meningitis amongst viral, fungal, parasitic, amoebic, and non infectious meningitis. This particular meningitis attacks the meninges, which is the membrane surrounding the brain, spinal cord, and is in charge of protecting the central nervous system. Risk factors of bacterial meningitis include age, primarily babies, large groups such as college campuses, pre-existing medical conditions, traveling to foreign countries, and working with strains of bacteria such as those who are microbiologists or else medical professionals. In order to prevent bacterial meningitis, vaccines are the most effective way. Here are three types of vaccines that have proven to be extremely effective when battling bacterial meningitis. So we have meningococcal vaccines, we have the pneumococcal vaccines, and the HIV vaccines. So bacterial meningitis is the result of several microorganisms. First up, we have the Streptococcus pneumoniae, which is the most common cause. It causes pneumonia and or ear or sinus infections. We have the Neisseria meningitidis, which is the upper respiratory infection, and it also enters through the bloodstream. We have the Haemophilus influenzae. This one is not as significant because vaccines have greatly lowered the chances of obtaining the meningitis through HIV. And then we also have the Listeria monocytogenes. This is located in unpasteurized cheeses, hot dogs, and lunch meats. This is the microorganism that is extremely risky for women who are pregnant. So symptoms of bacterial meningitis include fever, stiff neck, headache, nausea, vomiting, sensitivity to light, confusion, and also concussions have also been a repercussion of bacterial meningitis. And then in babies, they are often irritable, inactive, vomit, and they have inadequate feeding patterns when infected with bacterial meningitis. In order to determine if you are in fact infected with bacterial meningitis, you are to collect blood or the cerebrospinal fluid samples, and you're going to send this to a lab to identify the cause of infection, as seen in the past couple slides. There are many ways that you can contract bacterial meningitis. And this lab also determines what kind of meningitis it is, whether it's viral, fungal, etc. So there are many forms of diseases that are in fact similar to bacterial meningitis. Here are two. We have the hypothyroidism, and this consists of the symptoms of confusion, fever, vomiting, and headache. And we also have cirrhosis, which also has the symptoms of confusion, fever, and vomiting, both of which are very similar to bacterial meningitis. However, bacterial meningitis is way more severe as treatment is needed immediately. So as I just said, immediate treatment is required, otherwise this disease can be fatal. Treatments that have been exercised in order to prevent this is the intravenous antibiotics. We have corticosteroids, and then we also have a combination of antibiotics depending on how this bacterial meningitis was obtained from what microorganism. And also, while they're waiting for lab results to come back, your doctor may also prescribe broad spectrum antibiotics until you are able to determine how you obtain this meningitis. Also, drainage of the mastoids or sinuses is also proven to be effective in relieving pain when you are infected with bacterial meningitis. So we have prognosis, prevention, prevalence, and complications with bacterial meningitis. So for your prognosis, it definitely depends on the cause, on how you contracted this disease, because some forms are less significant and more treatable, whereas others are not as aided by antibiotics as we would hope. So definitely dependent on the cause. If it is left untreated, you have extremely high chances of death from this disease. Newports contract the disease very easily and have a death rate with treatment from 20 to 30%. Older children have a death rate with treatment around 2%, and adults' death rate with treatment is 19 to 37%. So as you can see, it is a very, 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 sorry, what's the word I'm looking for? Um, it is very severe. Prevention for this disease, the main way to prevent this disease is to get vaccinated as you're a kid, before you go to school. Those are one of your requirements before attending campus is to get your meningitis vaccine. Do not contain certain foods during pregnancy. Like I mentioned earlier, lunch meats, unpasteurized cheeses, those can all um, pass on the listeria form of obtaining bacterial meningitis. And if you're exposed to bacterial meningitis, make sure you see a doctor as soon as possible to get the antibiotics that you need. Um, this is a very prevalent disease. Within the US, there are approximately 4,100 cases a year and about 500 deaths a year from this disease alone. In men, it is more common than women. You have 3.3 cases per every 100,000 people in a population. And in women, you have about 2.6 per 100,000 people in a population. There are an ample amount of complications with this disease, especially if left untreated. Like I said earlier, there's a very high chance that you will die. But if you are treated, you still have a very high chance of obtaining some of these complications, such as loss of hearing, epilepsy, cortical blindness, cerebral atrophy, focal paralysis, and ataxia. So current research that is going on throughout the world while focusing on bacterial meningitis is developing new forms of treatment. Right now, one of the big ones that they're looking into is mechanisms with immune regulation and bacteriolysis, which is utilized to develop targets of adjuvant therapy. This will target the cells that are infected. Um, Thus, it will also strengthen your immune system in fighting this. There's an emphasis on gathering a blood culture sample prior to diagnosing antibiotics to determine the cause and type of meningitis rather than gathering the cerebrospinal fluid. And there's also an advocacy of monitoring intracranial pressure from the very beginning because, as mentioned earlier, one of the complications is epilepsy, and they believe that if intracranial pressure is put as a top priority when diagnosed with bacterial meningitis, that the rates of epilepsy will decrease as a complication of bacterial meningitis. And here are my references. Bacterial meningitis is a very, very intricate, delicate disease. It is something that you do not want to mess around with and something that is prevalent, again, especially for us students as we are on a large college campus and engaging with many different schools. So just be aware of symptoms, pay attention to your body. As I said, there are many types of meningitis, most of which are almost as severe as bacterial meningitis. So if you're experiencing any of these symptoms, please go see your doctor. Thank you so much, and I hope you have a great day.